Hey everybody, Dr. Sean Casey here again from Healthcare Complete, Back and Neck Pain Center, answering your questions. And today we're talking about kids and chiropractic. And a lot of folks always wonder, what's the best age to get adjusted at? And I'll hear stories about babies getting adjusted. And actually, that's a very, very common practice. I used to do a lecture for groups, and we talk about the process of actually childbirth. And we know how tough it is in the mom. Well, the baby too is been growing in kind of a fetal position, as we all know, for a long period of time with kind of a pull in the back and neck. And those tissues are a lot more flexible and designed to be able to move around. But if you look at a classic medical textbook and they talk about delivery, the doctor was instructed to grab the child's head, rotate it 50 degrees, 90 degrees to the right, and apply about 50 pounds of tractioning force. So that's a whole lot of effort. And I'd ask folks, does anyone want me to come around and rotate your head 90 degrees and traction with 50 pounds? Nope, no one did because it's a lot of work. So it's very possible in those situations where the upper two bones in the neck that do a lot of the rotation of the head and neck, those bones can get out of alignment. And when that happens, obviously just like when you or me, those muscles can tighten up, cause irritation, inflammation, even irritation to those nerve fibers. Now, one of the things we know is when we see kids that have constant ear infections, so they've had evaluations, they've had antibiotics to try and knock a bacterial problem out, but it keeps coming back over and over again. In some cases, because those bones are out of alignment, causing the muscles to tighten up, the eustachian or inner ear tube can't drain properly. And it's a great spot for bacteria to grow, so they have a consistent problem with infections. In some cases, kids do need tubes to actually straighten that eustachian tube out. And that's when a lot of ENTs can do a great job of helping kids with that. But I don't know if your kids are anything like my kids, but they spend a whole lot of time jumping downstairs, flying off beds, and beating each other up. So yeah, there's plenty of opportunities for things to get out of place. The great thing is kids bounce back very quickly. Even cases when we think about scoliosis, usually starts from something getting pulled out of place and the body just adapting to it over time, where the muscles shorten and tighten to stabilize those joints. And by chiropractic corrective care, we work to correct those mechanics, actually those curves can reduce or even be eliminated. So hopefully this was helpful. Happy to take a look at the kids. If you have any questions, give us a call. Take care.